Welcome everyone. Thank you for joining us for today's webinar. My name is Shivangi Kaushik and I'm working with Action Against Hunger. And today we have webinar on behavior change model in public health. So the presenter for today is we have Dr. Pawankumar Patil. He's head of department research, evaluation and learning. So Dr. Patil has vast experience in behavior change and action, and he also got award from World Health Organization for designing a software where they developed a software for physicians to code verbal autopsy. So I'm sure you guys will have a really nice session, and Dr. Patil will share some insight about the session. So now maybe we can start the session, Dr. Patil.
Yes, sure. Should I start?
Yes.
Yes, okay. Hello all, I'm Dr. Pawankumar Patil. So I am head of the Department for Research, Innovation, Design and Evaluation at Action Against Hunger, India. All of us are working in different areas. We are working in malnutrition, health, issues related to pregnancy, childbirth, and neurodevelopment. So all these issues, there are some assumptions behind every program that we are doing in the community, that the community is able to take care of some of the health issues, but there are still some issues for which we need to intervene. And that's how we go to the communities. We understand the problems. We try to design the solution. We try to implement them. Then we understand that, okay, this particular solution works or doesn't work. Based on that, we do the course correction and implement our final intervention, and then try to assess the impact, whether we were able to achieve few things that we planned beforehand, whether we were able to deliver the impact that we thought in the beginning of the program, and then we continue in the similar manner. The question comes that whether we are able to identify that right problem for which we want to find the solution. More and more research is being conducted, which tells us that it is very difficult to change the behavior of the people. If you just don't go outside, just introspect and try to remember one thing that you planned in the beginning of the year, that I will change this particular habit, I will modify this particular behavior of mine. And then we ourselves will understand that, next day itself, we face a lot of issues, not only from outside world, but also like our inner motivation, our inner drive. And then we say that, okay, fine, I'll try to modify this behavior some other time. So yes, every single behavior, every simple behavior takes a lot of time to get formed, and thus it will again take a lot of time to change. So there are various theories which explain how the behaviors are formed and how we can change them. So one of such theories or frameworks that we have been using in assessing the behavior change needs of the community, designing the behavior change interventions, and then implementing them. So yeah, thank you Shivangi for the introduction, and I'll explain this KSME framework for behavior change management. So what this KSME, it's basically knowledge, skill, motivation and enabling environment. So it's very simple framework, and we will see why we need a theory and what all theories are available, and why this particular framework is very easy to design, implement and adopt to any of the programs that we are doing. So why a theory? The role of theory is to untangle and simplify for human comprehension the complexities of nature. Very beautifully, very simply explained the need of a theory or a model. Now, sometimes we oversimplify things. We just know that, how this particular thing will work, how this particular intervention should be designed, or how this particular activity should be done. But there are tens of years spent by many researchers trying to understand every simple behavior. So Dr. Val Curtis from London School of Hygiene and Tropical Medicine, from last almost 20 years, she is trying to understand one simple behavior of people, which is towards this particular feeling of disgust. So around 15 to 20 years for this particular word. Yeah. So we try to make things very oversimplified, but they are not. And all these processes, the way through which our behaviors are formed and shaped, they are very complex processes. But it is not my job at this time to explain that complexity. Can we still try to understand how these behaviors are formed and how we can change through a simpler model? So let's have a look at what different kind of models and theories already existed. So there are models and theories at interpersonal level behavior change, intrapersonal behavior change, and at the community level behavior change. All these theories, they try to work on few constructs which are very important in that particular situation. So if you want to modify a behavior about smoking, the specific context and constructs towards smoking will play a very major role, and that's why that particular theory will get selected by the implementers to change that behavior. In the case of smoking, I think addictive nature of the tobacco is something which we won't be able to see in case of breastfeeding, right? Because addictive nature of tobacco and nicotine, we will have to look at it from different perspective, and that's why there are different theories for these different levels of behavior change. So the model that we are going to discuss today is the KSME model, the knowledge, skills, motivation, and enabling environment model. So I got introduced to this particular model while working with very famous researchers, Dr. Vishwajit Kumar. They work in Uttar Pradesh state of India and work in maternal and newborn health. So the model, as it is called the behavior change management model, is first used by them. But if you dig deeper, various other theories also talk about the similar construct, that we have to have a knowledge of particular behavior, skills to practice that behavior, motivation to practice that behavior, and enabling environment which will facilitate that practice. So another model which is almost based on the similar constructs is this information, motivation, behavior, skill model. So what is this behavior change model, the KSME model? It has 4 components, as you can see from the acronym: knowledge, skill, motivation, and enabling environment. Any behavior that we are practicing is result of these 4 components. So, and that's why for us to modify this behavior, we will have to work on all these 4 components. So let's say one example, smoking. It is based and it gets adopted by that person based on the knowledge that he or she acquires about smoking, the skills that she develops about smoking, the motivation. Sometimes it will be internal motivation, sometimes it will be peer pressure, and the enabling environment. Suppose in that particular community there is no shop from where one person can buy a cigarette. The environment will make that person smoke little less. Vice versa, if the person is surrounded by many other people who smoke very frequently, the person is part of that locality where the shops where you can buy cigarettes are easily available, then it is high likely that person will adopt that behavior. Again, as I'm saying, this is oversimplified version, but then it helps us to still try to visualize the complexity through a zoomed out view. So as I said, the behavior is formed with a combination of these 4 factors. The behavior will also get changed through the combination of these factors. So let me give you example of the project recently we are working on is newborn skincare practices. We realize that in newborns, sepsis is very important factor for newborn mortality. around 23% to 25% newborns die because of sepsis. In newborns, skin is the largest organ. And skin infections are very common, especially in the northern parts of India, in the southern parts of Pakistan, Bangladesh, Nepal. You will see that similar skincare practices are there. So what do? They massage newborns with this particular oil, mustard oil, and before applying that mustard oil, they scrub the baby. There is that thin layer of vernix on the newborn skin, which is actually very protective. But the family doesn't want to have vernix on the child, and that's why they forcefully remove it. During this process, the skin gets damaged. There are minute injuries happening to skin. And then because of poor hygiene and other skincare practices, the infection happens. And that leads to the newborn skin infection. We understood that, this particular practice is around 1,000-year old, and it is there in the entire Southeast Asia. So it is very difficult to change this behavior. Just to deciphering this behavior, we understood that traditionally particular knowledge is coming to the mother that how you should take care of your newborn. Then she's learning some skills from her mother-in-law, from her mother, from her neighbors, and other women in the community, how to massage the newborn. Her motivation is very simple, and that motivation is simple for every mother in the community, that she wants to do best possible thing for her child. And then enabling environment supports all these activities because this is the community practice. So how the newborn should be taken care of is defined for the entire community. So it is very difficult to change this behavior. We understood through scientific research that what all components should be there in the ideal newborn skincare practices. We understood that we need that oil, which is causing less irritation than mustard oil. We need a massaging practice, which is less rigorous. It is gentle massaging. Rather, can we also add some different level of massage where the neuro development stimulation can happen? And then for these three things to happen, what kind of enabling environment and community preparedness we would need in that particular community? So yes, there are two significant different behaviors. How can we do that? This particular knowledge, we need to contextualize that knowledge. So if I try to explain the mother and the mother-in-law, or the mother and the grandmother of that particular child, why it is important not to scrub the child's skin or use this particular oil, she won't understand. If I try to tell them the skin barrier functions and the role of linoleic acid in improving the skin barrier function, she won't understand anything. I need to tell her in her own terms. I need to provide the skills. It is very difficult to tell people do this one particular thing in the community level and expect that they will do in this particular manner. No, you need to do that skill building in the community. So this particular knowledge, we need to contextualize that knowledge. This particular skill, we need to give that skill, not only give once, but we need to understand multiple times whether she is doing this particular practice in the same way that is expected from her to achieve the maximum benefit. What is the motivation? As I said, that for the mother and for that grandmother, the child care and the wellness of the child is the uppermost motivation. How can we improve that? How can we build on that? So for example, in this particular case, we said that if you do the gentle massaging and use this improved oil, your child will cry less. The child will cry less. The child will sleep well. It will get less irritated, and the mother will also get some rest because of that. When we demonstrated that to the mother, this added level of motivation helped us for her to acquire that new behavior and accept it. But it was still very difficult to build on that enabling environment, because in the community setting, there will be grandmothers who will absolutely disagree with your opinion. There will be very key community influencer who will say that, we know it best, and you are outsider, don't tell us anything about this new practice. So in the healthcare facilities, there are people who are used to doing this particular newborn skin care in particular way, and we need to modify that. So enabling environment will come from the healthcare facilities, the community stakeholders, the women and people around that particular family, the father, the decision makers in that family. So all these 4 components we need to work on. So I'll just give you another example to explain how the knowledge, skill, motivation and enabling environment contribute to form a behavior, to modify a behavior and to sustain a behavior. This is very simple model, and I said that we can modify it based on our need. In case of smoking, we might need to think about few more components. We might need to think about that addictive nature of tobacco. But in few other cases where we are using some device or we are using some tool to facilitate that behavior change, we need to add that D factor, that is design. So the revised model will become knowledge, skill, motivation, enabling environment and design framework. So let me explain you with these 2 examples. The first example is Nirmal hand washing program that we are doing since last almost 10 years in different parts of India. We started it in a tribal block, tribal district of Maharashtra state, that is Gadchiroli. We realized that 47% of under 5 children's death can be prevented if they just wash their hands. So children washing their hands with the soap which is already available at their place, with water which is already available at their place. If we combine these 2 things, we can reduce the mortality by 47%. So in India, every single day, around 1,000 children die just because of diarrheal infection. Just imagine 470 of them are being saved just by washing hands. Diarrhea is very easy to diagnose. We just have to know whether the child is defecating more frequently with more liquid stool. It is very easy to treat. ORS is there. There are various other supplements are there. There are various other medications are there. If the child is very serious, we can provide the intravenous fluid. And it is even more easy to prevent diarrhea. Just wash your hands, drink clean water. And still, 470 children every day die in India just because of diarrheal infection. It was very difficult to believe, but yes, that was the reality. How we could combine these 2-3 things which are already there in that community. First, soap, water, and practice of hand wash. People do wash their hands just before worshipping the god. When they come from outside, just before eating, they just pour some water. But yes, they do know this practice of washing hands. They would wash their feet as well. Can we build on that? If I try to tell the mother or the grandmother or the father or the child himself that, you need to wash your hands so that this infection will not reach to your gut and will not infect your gut and then will not cause you diarrhea, that will lead to the dehydration, which will be very difficult to treat eventually, and then there is a high chance of you being high chance of morbidity and mortality. None of them will understand. They will say that we don't wash hands and we don't fall ill. So usually that is the challenge for public health, but it is very difficult for people to convince for the preventive activities. So for me to explain this particular child the importance of hand washing and what are the durations where you should be washing hands, we need to contextualize that knowledge. It is very easy to tell that one should wash their hands and cut their nails and use soap and water, but it is not that easy to demonstrate that skill, and people don't wash their hands. So there are studies where surgeons, they have to follow the World Health Organization recommended hand washing steps before surgery, but then they don't follow. So they don't wash their hands the way they're supposed to wash. So forget about these communities and children where hand washing is least of their concern. So still we need to build the skills. Can we build these skills in a way that they become something attractive for these kids and that becomes something interesting for the community, for the family? And we need to demonstrate that skill with very simple language, with very interactive way. What is the motivation of this particular child behind washing the hands? None. So we need to understand that if I want my community to wash hands, that's my need. They are not coming to us with the request of, we want some hand washing related program in our community. No, You need to understand that this is none of their concern. They did not come to us asking for that particular intervention. So we need to understand that their motivation level for hand washing is very low. How we can involve them in some activities through which they will get highly motivated to wash their hands. So that is another question. What is that enabling environment? I said that people do have water, people do have soap, they use it for cosmetic purposes. How can we combine these two things for hand washing? Can there be any sink-like structure established in the community where just looking at that structure, they will realize, and it will be a cue to action for them, that I need to wash hand at this particular moment. And then what would be the design of this entire program? And if, for example, there is a tippy tap in the picture, and you will realize that tippy tap, very innovative solution, very simple, very simplistic solution, but really poor behavior change for adopted associated with the tippy tap. You will see the studies where you will see that initially the children had thought that, children showed higher acceptance for tippy taps, but as time passes, within a matter of weeks, the tippy taps are out of use. When we understand why tippy taps are not being used for hand washing, we will realize that there are various design issues that are not being taken care of. The water is getting wasted, the water is soiling the clothes of the community, the child is finding very difficult to use tippy tap, the soap is falling off. So all these design things are there. We are trying to build the behavior of the community using contextualized knowledge, contextualized skill, motivation, enabling environment, but the behavior will still not happen if that right design is not there. So what should we do? We need to encourage children to wash their hands, not because it saves them from diarrhea, but we need to teach them that something interesting is happening if you wash the hands. It is nothing related to diarrhea, but it's a lot more fun. You become part of this group of cool children in the community who are washing their hands very frequently, who are having this tippy tap at their place, who are having their tippy tap kept very clean, very beautified, and they are the change leaders in the community. They are the ones who are leading something, and then others will follow if they are doing it right. These other factors play a very important role for these children to know that this particular behavior is important for me because this behavior is fun. This behavior is making me part of that particular group who is kind of very interesting and cool and all other things. So for that particular child, motivation is not getting saved from diarrhea, but being part of this cool activity happening in that particular village. So the knowledge again is very contextualized. The skills are tailored to that particular child. There are various skills involved. Even if you take example of this hand washing initiative, how to build this particular device. It's very simple. In the videos you will see online, even on the WHO website, there are very simplified versions of it. But yeah, you will need to build a robust structure so that it doesn't only last for a week, it stays there for years. For that, you will need to provide skills to build the structure. For that, you need to provide skills to use that soap in particular way and not in other way where the soap will get wasted. For that, you will have to provide skills on washing hand washing steps. Using actually hand washing steps, and then enabling environment in entire village and the schools. So for example, if we are implementing this particular behavior in the schools, what is the motivation for the Anganwadi worker? Yes, in her mandate, she is supposed to promote the hand washing activities in the school. Can we ask her that if you build this particular device, you can tell your supervisor that you are following this particular practice as recommended in your curriculum? Can we ask their supervisor, can we connect to their supervisors and the supervisors of school and tell them that if you go to the school, please ask about this particular device or this particular activity, and then if the teachers and students are practicing hand washing behavior, tell them, appreciate them for that and provide them good grades for this particular activity. All these things will make sure that the behavior is practiced. Not only practice once for the sake of practicing, no, it will sustain. I'll give you another example. In the picture above, you are seeing a mother giving kangaroo mother care to the child. It is very easy for a mother to hold a child to her chest. It is very natural. But this simple activity of holding that child to one's chest gives multiple things. If it's a mother, it helps the child to get protected from hypothermia. Hypothermia is the single most reason for newborn infection. And the entire global community is now promoting kangaroo mother care because it has shown better mortality and morbidity outcomes than the conventional incubators in the healthcare facility. So this is very simple, very natural, instinctive act of keeping the child close to your chest. Not only it just saves the child from hypothermia, it also stimulates the neurodevelopment. Third, if the mother is recently delivered, it will help secretion in oxytocin, which will help the secretion of breast milk. It will also help in contraction of uterus and expulsion of placenta. And there are it helps in postpartum depression. So this one particular single activity of holding the child to your chest can lead to amazing outcomes. And still, it is not practiced in the community. If I go in the community of, let's say, Dharni of Maharashtra or Raebareli of Uttar Pradesh and tell the mother that, you know what, kangaroo mother care is a very simple practice. Have you seen the kangaroo? The kangaroo, the way it holds the child to the chest, same way you have to do. This particular mother in Uttar Pradesh or in rural Maharashtra has never seen kangaroo. It is very difficult for her to imagine the kangaroo and then through that to explain the concept of skin to skin care. Can we then show the picture of a monkey who is everywhere in these parts of India holding the child very close to the heart? We might not call it a monkey mother care, but yeah, the concept is very similar. When the child gets hurt, the mother holds the child to heart. Yes, it's that security that mother can provide through that simple act to the child. Can we build on that? So the knowledge should be contextualized. She says that the child is irritated, but the moment she holds the child to her chest, the child starts getting calmer. Second, the child wants to drink breastfeed, and then it's that at the same place the child is getting warmth that is required for the neurodevelopment and prevention of infection. The breastfeeding is happening at the same time. The child is getting quieter, calmer. Mother is happy. Child is happy. But to practice this particular kangaroo mother care and get the maximum benefits out of it, you will have to do it in particular way. You have to provide that skill to the mother. It's not just holding the baby to the chest for a minute or so and then taking the baby away. No, there is a protocol. If you follow this particular practice for these many minutes and take a break for this short time, how you cover the baby, where you keep the baby, make sure that baby is not suffocated. What if the baby has skin condition? What if the baby have umbilical infection? If the baby is lying on mother's chest and abdomen while the mother is lying down, it will be very difficult for her to keep breathing. So what should be the ideal position for giving kangaroo mother care? All these simple skills are there. If you are not giving this skill, forget about getting the positive outcomes. For that, you will have to also provide her some supportive tool which will help her in providing the kangaroo mother care. So in the picture, you can see a wrap that we designed in collaboration with Lardell Global Health. And we wanted to promote kangaroo mother care and make the kangaroo mother care very easy for the mother, and not only for mother but other family members. So in this particular wrap, if you put the baby can stay there for a longer time. The mother is doing all the other household activities, because in these rural settings, it is very difficult to imagine that mother is giving kangaroo mother care to this particular child for hours. The mother-in-law will not be happy. The family members will not be happy with her if she spends excessive time with the child. So can this particular wrap or the tool help that mother having her hands free, and she can do all other household activities while still continuing giving the kangaroo mother care to the child? Can we provide that tool to her? Can we provide skills to use that tool? So with tool, it comes responsibility of teaching us the skills to use that tool. The next, what is the motivation for her for using this particular kangaroo mother care? Same motivation. It is your baby and you are going to do the best possible thing in the world for that baby. Second, can you still do it with doing all other activities at place? Your child is quieter. If it wants breast milk, you are easily going to provide the breast milk. If we try to modify the design of that particular wrap in particular way, you will see that she doesn't have to remove the blouse. She can breastfeed the baby without even being in that awkward position of taking off the blouse. So yeah, we will have to think for that component also. That can also become part of the motivation, where we can say that, using this particular method, you don't need to be ashamed of providing the best breast milk to the child, because nothing is getting exposed. What is the enabling environment? This tool itself, the kangaroo mother care wrap, can work as an enabling environment where this practice is being helped through this particular tool. Second, can we teach fathers the kangaroo mother care? Is it only mother's responsibility to take care of the baby? If it is breastfeeding, yes, she will have to breastfeed. If it is pregnancy, unfortunately, yes, only mother can conceive the baby. But there are many other things which in this particular society are delegated to the mother, which can easily be shared by other family members. Can we teach a father how cool this particular activity of kangaroo mother care is and how you can do that? And we had many various examples where then fathers thought that it is very nice to hold the child to the chest and then still not, and do all other activities. In this, the father and the child bonding is the thing on which we can build, so that will become motivation. Your wife will be able to work more. Your wife will be able to get the required rest. All these things are motivation for that father to practice this behavior. And then design. If you have this particular wrap, but the mother is not aware how to use that wrap, or she is finding it very uncomfortable using that wrap, she is finding it very difficult to tie it, she is not feeling secured. What if the baby defecates during the time when she is providing the kangaroo mother care? What if the baby pees during the time she is providing kangaroo mother care? Whether our design have already thought about all such consequences and situations, it is very important that all these things are incorporated in this design. So with this example, I think we are having clearer idea that we need to contextualize this knowledge. We need to give these skills, not only superficial skills, but we need to give them repeatedly. We need to assess whether they are following it right. We need to build on their motivation, the existing motivation. What is their motivation for practicing the old behavior, and what is the motivation we need to provide them for practicing this new behavior? What is the enabling environment we need to provide for them to practice this? And at the end, what are the design factors that we need to take care of while designing this hand washing device called Nirmal, or designing this kangaroo mother care device, kangaroo mother care wrap, or even like the stadiometer, the infantometer that we use in our daily life in the malnutrition projects that we are doing in different parts of the world. If she is finding our worker is finding it very difficult to carry the device from one place to other, there is a high chance that she would less likely to cover all the children and follow all the required steps for doing her job. This particular model, as I said, this is not some super special model. It just summarizes all other models and tries to incorporate all the gist from different models. I think it has been helping us in the past, and even now when we are working in different parts of India, in 4 different states, we are designing our various healthcare intervention and newborn care and nutrition interventions. We are mapping all our activities based on these 4 parameters. Are we doing something for knowledge? Are we doing something for skill, something for motivation, and trying to provide enabling environment? Recently, we met one person who is from this corporate entity trying to promote hand washing, and they have this particular product, that particular soap. They said that, if we communicate to the community that you need to wash your hands with soap, I think if they are purchasing the soap that is proxy for behavior, they are using this particular soap and they are doing hand washing, and we are very sure for that. Very simple question to them. Is it not possible that they bought this soap and then use it for bathing? Yes, it is possible. So if your assumption is that this particular soap is for hand washing, then you might be wrong, or this particular thing might not be absolutely right. Going ahead, how we can use these things, these 4 components of this model for evaluating the behavior change. Same, whether we could achieve the knowledge change in the community, the skills can be easily observable, motivation can be understood from whether they are practicing it or not practicing it, and interacting with them, and enabling environment is the entire societal structure around it. What were the results of this particular model in the past? As I said that Dr. Vishwajit Kumar, working with World Health Organization and Johns Hopkins University, did this randomized controlled trial in Uttar Pradesh using this model and demonstrated that around 50% of the newborn mortality can be reduced if we build on the community practices, just realigning their knowledge, skills, and motivation around the newborn care practices, and trying to provide the enabling environment so that that practice is sustained. So that's all for this model. I think thank you so much for listening to me patiently, and I would really like if you have some questions. So yes, thank you.
Yeah, thank you, Dr. Pawan. So now we will go ahead and take some time for questions now. Just a reminder to all the participants, please be sure to type your questions in the question box. That's just right on your left hand side of the Skype chat box.
मैंने पूछा
The question is, what according to me are the major barriers or challenges to implement the KSME model? I think it's a good question, and whenever we are using one particular model in the community to achieve behavior change, here in the context of behavior change, I'm answering this, it is very important what all factors are there we are trying to influence. If the advocacy team is working, and if the communication team is working, they will not be able to work on the skill building part of it. They will not be able to work with the communities because probably they are not the right people or well equipped to interact with community, and they will able to provide the intervention at some other level. Similarly, it is difficult for a frontline worker to provide to interact with the government health officers if they are also part of this behavior change process. So it is very important to map the behavior first. What in the beginning, what is the behavior? What part of it comes from the knowledge, skills, motivation, and where we are going to use the enabling environment part. It needs to get designed in the first place. Second, collaborations, if not done properly, and one person is doing everyone else's job, then it is difficult to implement this model. So the answer here is understanding the context of that particular community, contextualizing that particular knowledge. So if the knowledge, if I'm working in Dharani is one site of Action Against Hunger India, where the community talks in Korku, and it's a very specialized language because I'm just taking a minute to describe it. The closest relative of Korku is somewhere in Northeast India, and another closest relative is in this eastern part of the Philippines. So it's very strange how this particular language came here. And the context of this language is very different than routine other languages in India. The concepts, how disease happen, how the child is born, how the mother, the lady gets pregnant, how the death happens, all these concepts are very different. So unless we build on their context, it is difficult to achieve the behavior change. And so 4 things. What is the behavior? Have we mapped it already? And for every mapped activity, have we thought for alternative activity which will lead to behavior change? First, whether all the partners, all the players from the organization itself are involved in planning the behavior change program and implementing the behavior change program. That is second. And understanding the context. As I said, if I ignore the addictive nature of tobacco in the smoking related behavior change intervention, I will fail big time, because I will work on the knowledge, I will work on the skills, I will work on motivation, and I'll try to provide enabling environment. But hey, the person is already addicted and is finding it very difficult to get rid of that behavior. So yes, the intrinsic nature of that behavior also matters. How to measure the impact of behavior change? This is another big question which is always asked, how to measure the impact of behavior change. There are 2 things. First, behavior change itself doesn't lead to anything. So we don't ask people to just change the behavior. We ask people to change the behavior because we have understood that this particular behavior is linked with this particular health outcome. So one thing, the indirect way to assess the impact of behavior change is to assess its impact on the outcome. But then there are intermediate measures through which we will understand whether the person is following that behavior or not. In case of hand washing, what would be so let's take example of this particular device, Nirmal hand washing device. If someone says that, my child is washing hands regularly with this particular device and using soap and water, and you just believe us, it is very difficult to believe the self-reporting. But then sometimes we will have to believe. In this case, if I will believe what she's saying, but I will also go and check whether the device is already there. At present, by direct observation, the device is there. It is in good shape. It is usable. Second, whether the soap is available in the family, whether the soap is there attached to the device, and it is showing the sign that it is being used. Then I will say that probably the behavior is practiced. What are the ways through which I will understand whether the behavior actually led to the desired outcomes? I will have to do different kind of survey and assessment, whether I will see map the entire community and see whether there is any change on the diarrheal diseases or skin infection or conjunctival infections. So so I think these are the 2 ways. So direct reporting, direct observation, and the impact on outcomes. Through these 3 ways and then other innovative technology and methods, we can assess the impact of behavior change.
So yeah, it was something really interesting to understand, and the question was really good, which we really, often we land up in such situation that we do a lot of behavior related stuff on field, but at the same time, the institutions to whom we are reporting, they really want to know the impact and how we are measuring it. So thank you for that fantastic reply. So maybe we have one more participant writing up, so you will have another question.
Yeah. Shivangi, can we let them speak, because it is taking some time to...
No, it's already there.
Okay. Does Action Against Hunger has a supportive BCC model being told? Does Action Against Hunger has a supportive BCC model and how it can be improved? So we are working on understanding the BCC model different models that we need in different communities and for different programs. So yes, we do have a theory of change for every program that we are implementing in the communities. We are also trying to build different models through this particular lab that we recently set, that is Design, Innovation and Research Lab at Action Against Hunger, India. So yes, we do have existing BCC models and strategies, and we are building and learning newer tools. Can technology be used to do these things, to help in facilitate in behavior change? The similar message that we have been using for promotion of nutrition, can we use some tools to explain, few more tools to explain? Recently, we have had a great workshop where the workers of the organization are trained in doing theaters of operas, doing puppetry show, doing small nukkad nataks, through which we will provide the contextualized knowledge, which will be very interesting to gain that knowledge, and also provide these soft skills and hard skills to the community. So yes, we are working on that, and it's a continuous improvement process. Thank you. Okay.
It's look like we have covered all of your question, Dr. Patil. So is there anything else you wanted to cover up before we wrap up this session?
No, that's all for now. And I would really like if the participants have more questions, they can email, and I would love to respond to them. The thing is that this is very simple model, and one can use any model they think right for that particular question. But I think a framework gives you that complete view, so that you know that you have covered every possible aspect, and then still there will be other factors. So the model will be KSME DO. O stands for other, which will have to be incorporated, but that is the need for that particular question. So yes, yeah. Thank you so much.
So can you please type your email ID in the box?
Yeah. So this is my email ID, and you can send your questions on this ID. Thank you.
There are few more questions, I guess, coming up.
Yes, I can share a document where different models are used to deal with different public health and behavior change issues. So yes, I can share a document about this particular model. I will be able to share that the main paper in which KSME model was described. And if you want to know how we are using in Action Against Hunger, eventually I'll be able to share a report with you where we are using the similar models for different behavior change intervention. So it will take some time, but I would be very happy to share. So just send me an email on this, and whenever it is ready, I'll share it with you. Thank you. For the ready reference, I think there is a very beautiful book called Planning, Implementation and Evaluation of Health Promotion Programs, a primer by Mackenzie, Niger and Thackeray. It's a very beautiful book. It covers many other behavior change models and theories. So I can also share a link. At this time, I don't have a link, but I can share a link later. Yeah, thank you. Okay, so let me just type it here. Planning.
Okay, so I would like to, I think that everybody would lo like me to express appreciation for your inspiring presentation this afternoon. And I would say your years of research and your depth of understanding on this behavior change model and your ability to present the subject was so good that you presented in such an interesting way that it produced one of the most memorable presentation of the day, I would say. So I would personally appreciate your approach to anticipating users' intents and adapting the model as per the context. So thank you so much for sharing your experience with us. And I really look forward for the next webinar tomorrow, which is on how like some IT issues that we day to day get stuck with. So there will be session on that. So great. Thank you everyone. Thank you all the participants. I really appreciate your presence being here. And thank you again for joining us today. And we will see you tomorrow. Thank you so much.
Thank you all.